Opinions expressed on this show by Dr. Del Campo are solely her own. Her opinions should not be taken as medical advice. It is strongly recommended you consult with your own doctor before undergoing any cosmetic or dermatological treatments.
Welcome to Derm Talk with Dr. Roberta. I'm Dr. Roberta Del Campo.
I am Henry Del Campo.
And today we're going to discuss aging skin and what that means on a molecular level, which I think is quite interesting.
Yeah, no, I think it's going to be fantastic because you got extrinsic aging and intrinsic aging, which I think is definitely your specialty, right?
Yeah, it's important. I think most people just think about what we see on the outside. And so I have patients come in saying, I look older. What does that mean to them? It might be different for everyone. Some people look at lines on their face. Others will look at the way that their skin is changing. So it's starting to look thinner or more rough. They don't have that glow. The plumpness is gone. And then others might say, I'm sagging. But we know that it's different things that are contributing to this type of aging. And I would say the whole extrinsic factors really leads to what's happening on the outside. So extrinsic means sun damage. It means pollution in the air. It means being exposed to unhealthy lifestyles such as, secondary smoke on a daily basis. Intrinsic is what it sounds like from the inside. So that's really what's changing on the cellular level. And that tends to be more related to our genetics. So, we do know that it can be also related to diet and sleep and other things that, occur, but it's really about less of a controllable way that we age from the inside out. So it's really important to think about what we can control and what we can do to kind of slow down that aging process, and things that we may not necessarily be able to control, but we can do things to help maybe, minimize those signs of aging.
So how do men and women differ in terms of skin aging?
It's interesting because men tend to start a little bit quicker. And I think that's a common misconception. They say, women start younger. Actually, men start to age a little bit sooner, but they age a little bit slower. And women, we tend to start a little bit later, but we have this kind of increase of aging that's pretty quickly, particularly when we hit menopause. And that's really due to hormonal changes. I would say majority of men that come in and say, I want to work on how I look. I feel like I'm looking older. It tends to be around the eyes. So they come in complaining of hollowness or bags or even crow's feet, and also under the chin, the jawline. So whether it's a submental fat pad or losing contouring. Mm-hmm. Women, on the contrary, tend to actually notice signs of skin aging more. So they're coming in saying, oh my gosh, I have wrinkles, my skin is dull, it's thinning. So they're actually more focused on the skin quality itself and a little bit less about the contouring or something like the crow's feet. I would say they also tend to notice their neck. So they're saying, my neck is thinning. I'm starting to get a lot of fine lines and wrinkles. But again, they're more focused on skin, which is why I think it drives them into my clinic to think about treatments such as lasers or resurfacing.
So what do most patients point out in your office?
I would say number one, sagging skin. They come in and say, I'm getting the jowls. I'm just looking old. Everything is coming down. And interestingly, it's not typically from one thing. It's really multifactorial. So I would say when we think about sagging, it's the skin is thinning. The skin is losing elasticity. But interestingly, also our bone is thinning. So we start losing bony prominences in our cheekbones, our jawline. We're losing that support system. So that's why it's important when you're seeking medical advice that really, as a provider, I'm looking at all of the potential causes and I'm offering treatments and recommendations to really address all of those contributing factors. So, for example, if their skin is thinning because of aging, they're losing elasticity, their skin is looking more dull, I'm going to think about lasers, I'm going to think about resurfacing treatments to really thicken and tighten the skin. When I'm thinking about volume loss, so someone's coming in and they're starting to look more hollow in their cheeks or under their eyes, and that can be a sign of aging, I'm going to think about injectables such as fillers. If, someone comes in complaining, if you will, of lines on the face that are due to muscle movement, I'll think about Botox or neuromodulator injection. So that's where kind of a comprehensive game plan really is going to give the best results and give them the most natural enhancement. But it can be so many different changes in terms of underlying structure and support from the bone, bone to structure and support of the skin itself and even the
Mhm.
fat pads.
Is there anything out there that accelerates volume loss? It could be lifestyle. Or maybe you spoke a little bit about some of the extrinsic factors, but does anything accelerate volume loss? And then what is the difference between volume loss and perhaps some changes in your bone structure, I guess, itself?
So volume loss tends, when we think about kind of fatty areas like the buccal fat pad under the eyes, we tend to see acceleration in someone who loses dramatic amount of weight very quickly. We see that often in runners who tend to look gaunt and hollow, or someone, now we have all these medications that can be prescribed to increase weight loss. I'll see patients come in and they look quite hollow and sunken. So, yes, you're losing weight elsewhere, but you're also losing it in your face. When we think about bone loss, really bone loss tends to be more genetic, and it tends to be in certain areas like the mandible a little bit more than other areas. That's why they say jokingly that, as you age, your ears and your nose grow because they're cartilage.
Mhm.
So they stay the same, and then your bone actually gets smaller. So it makes those areas look a little bit more accentuated. But bone loss, I would say, tends to be a little bit more of that intrinsic kind of genetic factors.
So, what treatments can help these signs of aging?
It depends again what we're trying to treat. So volume loss, we think about injectables like fillers. We tend to use more of the hyaluronic acid fillers to plump and volumize the face. When we're thinking about the skin, thinning, losing collagen, elastin, I would say the number one would be collagen stimulators such as radiofrequency treatments to firm, tighten, and increase collagen production, microneedling, resurfacing lasers like Tixel or Fraxel. And those are all things that we can do in office, but also as we were talking about skincare, it's important to think about a daily product such as a retinoid or retinol, retin-A, human-derived growth factors, peptides that you can apply to your skin on a daily basis to start that improvement in collagen production. Bone loss is a little bit trickier. I know there are injectors in my field that use certain injectables off-label to try to increase, bone strength and thickness. I wouldn't say that I have as much experience with that, and it's anecdotal, so I can't necessarily back that at this time, but I'm sure that there are going to be more treatments that are coming out in the market to really address bone loss because that really does give us the structure and support. We can try to mimic bone, make it look like bone by injecting something like Radiesse, which I love because it looks and mimics your bone. It has calcium hydroxyl apatite, but it's not actually replacing bone loss or minimizing bone loss.
Mhm. So, why don't we expand on those in office treatments specifically for collagen?
Yeah, and I would say collagen is quite a buzzword because we know that that really is the support system of our skin. So, to give a quick educational tip, think of collagen as being kind of like the brick mortar, right, of your skin. So, it's actually what gives us structure and support. Then we think about elastin. Elastin's kind of like the rubber band. It allows us to stretch our skin and bounce into place. Then we have ingredients like proteoglycans. Proteoglycans actually give us a glow and a radiance to the skin. Hyaluronic acid that hydrates the skin. And then we have blood vessels in the skin that help to add nutrients to the skin. So it's important to understand what different ingredients make up skin and make up the health of our skin. And I would say number one for structural support is collagen. And collagen, interestingly, there are many treatments out there that can stimulate collagen. For example, microneedling, we call it in layman's terms collagen induction therapy. So we're purposely making a wound in the skin to make it develop new collagen. Think about when you scrape your knee, your skin tries to heal by building more skin strength and repairing that.
Yeah.
And that's what a lot of these procedures do. So microneedling, resurfacing lasers, resurfacing energy-based devices, Tixel, Fraxel, CO2 lasers, erbium YAG lasers. Those are mimicking wounds to stimulate new healthy skin to grow. And then you have something like radiofrequency. Radiofrequency basically uses heat. So lasers use a laser light to produce heat. Radiofrequency uses radiofrequency energy to induce heat. Ultrasound uses ultrasound technology to induce heat. But ultimately what we're doing is we're either using heat to wound the skin or mechanical wounding, like with microneedling, which uses little tip or a little pen that makes tiny little holes in the skin to repair itself.
Mhm.
But ultimately, the goal is to form a controlled wound to heal to improve the thickness and the strength of the skin.
So everybody's a little bit different. Would your approach be whether it's microneedling or whether it's some sort of energy based device? Is there any? I mean, does any skin type stand out?
Yeah.
Where you're like, you know what? Absolutely, I got to use microneedling here, or or
Yeah,
the
I
other?
would say, I mean, that's where, going to someone who understands different technologies and understand what's going to be best for your skin, but also I have to understand my patient's goals and lifestyle. So, for example, I have two big, combination therapies, one called Rejuvenation Duo and the other is Rejuvenation Duo Light. And Rejuvenation Duo is a bit more hefty than the Rejuvenation Duo Light, as it sounds, because I'm using a laser to improve discoloration of the skin, but I'm using an intense energy-based device called Tixel to really resurface the skin. So I'm using two types of wounding to the skin. I'm using heat because Tixel has a very high temperature, but I'm also using, it looks like a little stamp, almost making tiny little mechanical wounds in the
Mhm,
skin.
mhm,
That's going to be much more intense than something like microneedling, which makes little wounds in the skin, but without heat.
mhm.
So microneedling and the Rejuvenation Duo Light is going to be for somebody who wants less downtime, who needs maybe just a little brightening, a little bit of firming, some fine lines and wrinkles, maybe somebody in their 20s or 30s, or someone who has done these intense treatments for correction, but really wants to do maintenance, or for a patient of mine that just wants virtually no downtime.
Mhm.
So it's understanding somebody's skin concerns, understanding their goals, but also understanding what they're comfortable with in terms of lifestyle and healing. Like some patients or myself, I don't mind doing an intense treatment and walking around looking a little bit, kind of quote unquote beat up for a week or so. I don't mind that because I know ultimately I'm going to have fantastic results. But I also have patients who just say, I don't want even one day of social downtime. And that's where the beauty of technology comes in and the beauty of choices comes in because I can really tailor my treatments to that. And, some offices might have one device, so everyone gets the same treatment no matter what. That's why, I became a laser institute where I hand selected different treatments and devices on the market to really be able to personalize that for someone.
So when it comes to aging, talk a little bit about diet and stress levels, sleep.
Yeah. And this is something I think that's unfortunately quite forgotten. So, we think about what we're going to do for our skin health in terms of what we're going to apply, what treatments we're going to do in office. But there is a lot of data out there that elevated cortisol levels can cause damage to the skin. So, we make less collagen, we just don't heal as well. And so, anything that induces stress on the body, so whether it's lack of sleep, whether it's eating a poor diet, whether it's environmental damages, whether it is having bouts of illnesses over time, whether it's not having the proper nutrition, all of that can increase stress levels in the body, which ultimately increase inflammation, increase cortisol levels, and actually work against our skin health. So it's important. And, interestingly, I had a patient the other day that came in and I walked in the room and I said to her, I'm like, oh my gosh, you look amazing. Like, what have you done? And I see her every 4 months or so for, injectables. And she said, oh, I've been getting sleep. And she laughed. And I said, oh, it's interesting because it's noticeable. And I think she thought, how can I look so different? And my assistant, Janet, said the same thing. She's like, I was saying the same thing. And it's all because of sleep. She had been going through some stuff at home, wasn't sleeping well for many years, and finally has now taken charge. And just having sleep made her look fresher and healthier. And it's not just about the dark under eyes, it's really about her skin quality being better because of lower stress. I will also tell you, I've seen patients that come in that I say, what are you doing? Your skin looks great. Oh, I have better nutrition. I'm eating more antioxidants. I'm eating more fish. I'm really trying to be, more health conscious, mainly for my weight, but it's affected their skin. So it's really interesting that without them telling me, I can walk in the room and see who's eating a healthy diet, who's getting enough sleep, who has less stress. And I can see those fluctuations throughout the year, even year after year with various patients. So it is noticeable. And that's also where things like pregnancy come in. I mean, having 3 kids within about 4 years, it was something that I really had to work on the minute that I gave birth because I really saw the loss of elasticity. My skin just didn't feel the same. Granted, I was cutting out treatments and products that I had been using for many years, but it really was about the stress, if you will, of the pregnancy on my body. But the beauty is right away, the minute, you birth or the minute you make a change in your diet, you really can transform the skin pretty quickly with the right treatments and the right skincare regimen.
So the manner in which we age, I think, has a lot to do with who we are, who our parents are, who our grandparents are, and kind of what we've inherited, right? So how do you is there a particular approach around seeing somebody and then maybe even being familiar with maybe their parents, or if somebody, a patient comes to you and says, hey, you know what? I'm looking at my hands and they're aging just like my mom's, right?
Yeah.
I think you see a lot of that. So talk a little bit about how really aging is significantly impacted by who we are and how we've inherited that, right?
Yeah, I think that's really an interesting point because it's something that I see often. I tend to treat a lot of mothers and daughters and sisters and or even without that family member that's a patient of mine. I have patients that come in often and they say, look, I'm starting to get thinning in my neck, just like my mom. I want to work on that. And I personally have been through that. I mean, my mom, as we've discussed, she passed away a few years ago, but I knew what changes I was likely going to have based on what I saw. So, for example, her neck skin was always something that bothered her and she had to work on around her eyes. So for the last X number of years, I've really thought about focusing my energy in those areas. So when a patient of mine comes in and says, I noticed my mom has a double chin and as she aged, I didn't like that area. What can I do? I tell them start now. So let's make that a priority. Even if we don't see the obvious changes yet, let's think about a preventative technique in that area. Obviously, my style is always about prevention everywhere, but specifically in areas that we know are going to age a little bit more rapidly or tend to be a genetic concern, we can think about being a step ahead. So it's not as difficult to correct. Prevention is always better than correction if possible. So I would say the most common areas that people mention, I saw my mom look like X, it's usually around the eyes and I would say the neck and jawline area. And that comes down to bone structure, which tends to be inherited. That comes with fat pads, right? So some people have, rounder cheeks and others have more hollow cheeks. And that also comes with skin quality. Someone that has a certain descent from their parents, they might have thicker skin, and somebody who comes from another, nationality might have thinner skin. So it goes back to how we're going to work on multi-components of the skin and the bone, and really to preserve what we have to keep us looking youthful and make us looking young. But, I think there are many treatments that no matter what skin type you are, how dark or light or thick or thin or dry or oily your skin is, almost everyone can benefit from a collagen stimulator, whether it's radiofrequency, microneedling, a resurfacing device based on skin needs, and then also things to boost collagen and elastin, specifically glycol therapy. So those really are a go-to for almost everyone. Injectables are very personal.
Yeah.
Some people want to work on lines for movement, others don't. Some people want to volumize their lips or under eyes, and some don't. But when it comes to genetic aging, it's really about those heat-based devices and treatments that are going to thicken the skin and tighten the skin and lift the skin.
So talk to me a little bit about two areas when it comes to aging that I don't think people overlook it, but it's one of those that it's right in front of you every single day, and unless you really pay attention to it, it kind of just goes by the wayside, and you wake up one morning and you're like, whoa. And I'm talking about the hands and the neck, right?
Yeah.
So, and clearly our hands are in the sun every single day, our neck, I think the same. So what, how are you addressing that? And like, what procedures do you have in place to really address the hands and the neck?
So let's start with the hands, because I agree. It's an area that we don't think as much about on a daily basis. But when we start to notice those changes, it can age us very quickly. I would say that when my patients come in talking about their hands, almost always it's thinning of the skin. So you're starting to see the little blood vessels, you're starting to see the tendons. Think about an older person, their hands just look thin and old, and you see all the structure underneath.
Mm-hmm.
So we think about things to boost the collagen, to potentially increase the volume in that area. And I would say my favorite injectable there is hyperdilute radius, because I'm injecting a product that's going to build collagen, build elasticity, and we can dilute it in a way that you actually have immediate volumization. You can also use hyaluronic acid fillers. I just tend not to like them as much because they don't have the longevity, but they do give an immediate plumping to the skin and can help with that appearance. When it comes to sunspots and uneven texture, we think about lasers for color. So I love YAG lasers. They're very safe on the body. And then we think about smoothing out the skin, whether it's radiofrequency, whether it's microneedling, radiofrequency microneedling, etc. But I would say the number one treatment is hand filler.
Yeah.
But again, I tend to go more towards that biostimulatory injectable hand filler versus a hyaluronic acid. For necks, it's actually quite similar. My number one treatment for the neck is hyperdilute radius because of the thickening, the tightening, and many energy-based devices you cannot use over your thyroid or in sensitive areas. I also love Ulthera, that to tighten and pull the skin back. but a lot of it's also color correction. I mean, there's something called poikiloderma of Savant where you look at the side of the neck of individuals and it looks red, brown, and patchy, and that's due to sun damage. And so just correcting the color by using lasers to blend the red and the brown, like the Aerolase Neo Elite, like the Symphony laser, those devices can be used to improve the color, which frankly makes everything else look less noticeable. So I would say it's fairly similar to other areas of the face and the body. But as you go down, rule of thumb from the face down, you have delayed healing time, so longer healing, higher risk of hypertrophic scarring, so scarring that can be thick, and that the skin just doesn't heal as well. So rule of thumb is you have to be more gentle as you work away from, the upper face or the face and then going down towards the neck, chest, and other areas of the body.
So when it comes to aging, specifically around the mouth, that's another area that, especially personally, I feel like women are very conscious of that. But
They
I
call
think
them smokers' lines.
yeah, smokers' lines, right.
Yeah.
That's right. What procedures do you have in place to go ahead and address that?
It can be tricky, and I agree that it's an area that many women feel a bit self-conscious about. I mean, it's an area that I'm already seeing in my 40s that I'm starting to get lines because I'm very animated. I have a lot of facial expressions, but it can be tricky because things like Botox or ZMN or Dysport, so a neuromodulator, can slightly affect how you speak and or what it feels like. So I'm not a huge fan of it. I will sometimes do a unit or two in each area just to prevent, but I don't like to fully correct in that area because again, the way that I speak, I like to drink from a straw, etc. We also have fillers, but it's important to choose a hyaluronic acid filler in this area because it's more about plumping those lines, but you want something very gentle. Like I love my two favorite products are Bellatero Balance and RHA Redensity. They give a very natural enhancement. And then we can think about resurfacing. So I personally love Tixel in that area because it smooths the lines by building the collagen. It helps to make the skin reflect more light. So it reduces shadows in that area. But it's really about resurfacing. It's about neuromodulators and it's about potentially fillers as well. And that goes back to lifestyle.
Yep.
So someone who's a singer, I have a patient who's a singer and she's like, I will not put Botox around my mouth because it affects and somebody, let's say, who says, I'm just scared of fillers. I don't really want fillers. Tell me what else I can do. So we have different options. And many times, again, it goes back to a comprehensive treatment, like a sprinkle of neuromodulator, a little bit of filler, and maybe a resurfacing that's going to be more long lasting.
So is there anything that you recommend on the prevention side when it comes to the lines around the mouth?
Yes. So obviously smoking is probably one of our number one. Also using straws. So anytime that you really have to purse the lips. So patients of mine that are concerned about that, I say try to minimize straw use. I like straws, but I don't use them that often.
Yeah.
And I would say the other thing is using a retinoid in that area. And although it can be a sensitive area, we want to stimulate collagen. So it's really about repairing and building in that area because the thicker the skin is in that area, the better it's going to respond and the less of those lines that are going to form. Because many times it's from movement, but it's also just from the skin thinning and that area can have thinner skin. If you can't use a retinoid, we'll go back to the human-derived growth factors, but there are products that will help or peptides that can help to build that collagen there.
So if you're using a retinoid in that area, is there potential complications around putting that over the lips? No.
No, I mean, what I typically recommend is using a little Aquaphor prior to applying. And many of my patients, even if you use a retinoid over the whole face, putting a little Aquaphor around the eyes or the lips, it prevents diffusion into that area. It's just going to make, and I've done it before, it just makes your lips quite dry. So meaning if you forget to put the Aquaphor or it bleeds a little in that area, your lips might get dry. If they get a little cracked, you can use an over-the-counter hydrocortisone. But the goal really is to protect that diffusion by putting a little Aquaphor or Vaseline.
So that is great. This is definitely a topic that I think so many of us can relate to. So I think this episode is fantastic in terms of really covering that. And I'm sure it's going to come up again in a future episode.
I don't doubt it.
Yep.
Thanks for joining me on Derm Talk with Dr. Roberta. Please like this video and subscribe to our YouTube channel or on iTunes, Spotify, or anywhere else you get your podcasts. I'm on Instagram at Dr. Roberta Del Campo and would love your feedback on this episode. Visit my practice at www.delcampoderm.com or my web store at www.drrobertaskincare.com. See you next episode.